It's really quite remarkable, isn't it? People are living longer, healthier lives overall.
It truly is an achievement.
But, well, there's a flip side, a major challenge that comes with it. Cancer in old age. Just think about this. In Europe, around 60% of new cancer diagnoses, and get this, 73% of cancer deaths back in 2020 were people over 65.
That 73% figure is just staggering, really highlights the issue.
Exactly. And we're not just talking numbers here. This is a vulnerable group, often dealing with late diagnoses, maybe less aggressive treatment paths.
And a system that feels, well, incredibly difficult to navigate.
Fragmented.
Absolutely fragmented. It really demands a focused approach, doesn't it? And that's
Yeah.
precisely what we're going to unpack today.
Yeah, and what's crucial to understand is just how layered this problem is.
Yeah.
It's not only about the medical side, the diagnosis itself.
Right.
We're dealing with individual physical needs, emotional needs, definitely, but also these bigger systemic things. Social isolation is huge.
Potential financial pressures and, the massive burden on family caregivers, which often goes unseen.
That's a really important point.
So many older people with cancer and their families, they're sort of left trying to piece things together, struggling to find and actually access the health and social services that can make a real difference.
You've really hit on the core problem there, the sheer difficulty of navigating it all. And this is where this Horizon Europe-funded project, EU Navigate, comes into the picture.
Yes, a major undertaking.
It is. It's big. It's interdisciplinary, crosses several countries, and their mission seems crystal clear. They want to rigorously test how a specialized support system, they call it a navigation intervention, can genuinely change things for older people with cancer and their caregivers.
It's about bridging that gap, isn't it, between the clinic and everyday life?
Precisely. So here's where it gets really interesting, I think. The heart of this whole thing is the navigator.
Okay.
And this is key. They're not part of the main medical team. Instead, it's a dedicated person, often a highly trained volunteer, although I think in Poland they're using social workers for this role.
Interesting variation.
Yeah. And their job is basically to step in, to support, educate, empower. They're there to knock down barriers, practical ones, emotional ones.
So making those connections.
Exactly. Connecting people to the resources and support they actually need. Maybe helping an older patient sort through confusing appointment schedules or prescription forms after chemo.
Things the medical team might not have the bandwidth for.
Right. Or finding a support group for their spouse, arranging transport. It's those real-world practical hurdles.
That's a powerful concept. So how is it actually, structured? How does it work on the ground?
Well, they've cleverly adapted a Canadian program. It's called NavCare.
Yes, I've heard of NavCare. Navigation. Connecting, advocating, resourcing, engaging.
That's the one. And the reason they picked it, it seems, is because it's deeply person-centered, family-centered too.
Which is critical.
Totally. It's all about improving quality of life, making sure people get timely access to the right services right across the whole care journey, from diagnosis through treatment, recovery.
And even end-of-life care.
Yes, even end-of-life and into bereavement support.
That continuity must be invaluable.
It sounds like it. So for someone involved, the navigators are proactive, but also responsive. They connect people to formal supports, but also informal ones in the community.
Like neighbors or local groups.
Could be, yeah. They advocate for the person's quality of life goals, help find resources, and really try to engage them in what still matters most to them.
And how often do they interact?
They might meet every couple of weeks, maybe more often if needed. It adapts. And as we said, that support can continue right through, offering a consistent presence.
Okay, so connecting this back to the bigger picture, the EU Navigate project isn't just delivering this care.
No, not at all.
They're rigorously evaluating it, setting up a pragmatic, randomized controlled trial, right, across 6 different countries.
That's right. Belgium, Ireland, Italy, the Netherlands, Poland, and Portugal.
Wow, quite a diverse mix.
It is. And that multi-country aspect is so important, isn't it? Testing in different healthcare systems, different cultural contexts.
Absolutely. It makes the evidence much stronger, more generalizable if it works across those settings.
And you mentioned pragmatic trial, meaning they're testing this under real-world conditions, not just in a perfect lab setting.
Exactly. Which is vital if you want findings that can actually be used.
Plus, I found this part really interesting. It's a fast-track RCT.
Okay. What does that mean in this context?
It means that while one group gets the navigator intervention right away, the control group doesn't miss out entirely. they actually get the intervention too, just after 24 weeks.
Oh, that's quite an ethical approach.
Isn't it? Everyone potentially benefits, but they still get that crucial comparative data quickly. Very important for policymakers needing timely info.
Makes sense. So the goals here are pretty ambitious then.
Definitely. Assessing effectiveness, obviously, but also cost effectiveness.
Always key for implementation.
And figuring out the best way to implement this model in these very different healthcare systems.
Right, because what works in, say, the Netherlands might need tweaking for Portugal.
Exactly. Ultimately, it's aiming for, well, a whole package. Better quality of life for patients and caregivers, better access to care, maybe reducing the societal burden.
And hopefully actionable policy recommendations that can actually be put into practice.
Yes, that seems to be the end game. So when you pull it all together, EU Navigate looks set to deliver some really high-quality evidence. Evidence on a model that could genuinely lessen the burden and improve well-being for this growing, vulnerable group across Europe.
It really could change how we think about supporting our aging populations, especially those with complex needs. It's showing, potentially with solid data, how this kind of holistic, person-focused navigation can lead to fairer, more sustainable healthcare.
So for you, our listener, this deep dive gives a real insight into a huge international effort to innovate care. And it does make you wonder, doesn't it? If this kind of human-centered navigation tested properly in the real world can make such a difference for older cancer patients, well, how might that whole approach reshape healthcare globally for all sorts of chronic conditions down the line?